car score. And I was able to message Dr. Felix Cabrera. I think he's the only one who could do the math on that thing. But he responded, there's still a minor delay due to cross-referencing and getting updated reporting from all labs. But preliminary car score of 39.3 will be finalized by this evening's JIC release. Because if you see the graphic we had put out in the JIC release last night, they said the car score was 37 point something or other.
Oh, yeah.
But that was what they said it was yesterday morning. And obviously we had more positives. And so that's what's going on if you guys are tracking that car score.
You know it's going to be bad if the number of positives are high.
Yeah. But it depends on how they do the math.
Yeah, okay, whatever.
Okay. Dr. Ann.
Good morning.
Good morning, Guam. Good morning, Dr. Ann Pobutsky. Territorial epidemiologist.
How you doing?
How are you doing, Doc?
Well, it's been quite a week.
You think?
Very busy. Yeah.
Right.
Well, we're up to almost 6,000 cases, 91 deaths. The good news, we haven't had a death in the past day or so that's good. Knock on wood.
Crazy.
But as you just mentioned, the car score is because of these clusters that we've seen at the construction, barracks, and other congregate settings, DOC. So that has driven up the score quite high, the COVID area risk score. So yes, we're trying to address these significant clusters in congregate settings.
Right. So, Doc, the train of thought yesterday when we interviewed the Adelup press secretary, Crystal Paco San Augustine, and Dr. Cabrera, what they had kind of been consistent about saying was that clusters are clusters and they are separate and apart from like community spread. But then we had the Dean of Nursing, Dr. Margaret Hattori-Achima, who, kind of as an aside in a different conversation had said, hey, just because a cluster is a cluster doesn't mean we're safe. So I wanted to get your opinion on that. So when they talk about these clusters with Black Construction DOC,
Cortec.
And Cortec, right? So they kind of allude that, because they're in these places where it's congregate setting, it doesn't really impact what's happening out in the real world, I guess, for lack of a better term. What are your thoughts on that?
Well, it may not, because especially the prison, it's very limited access in and out, but somehow it got in there. It was just a matter of time. I've been looking at Hawaii a couple months ago. They had it spread through their prison. And so we're trying to contain that. The barracks are a different story because these construction companies have a lot of subcontractors and local hires, as well as the H2 workers. They have quite a few local employees as well,
right?
Hundreds of them. So, but the important point is not that this is a big risk to the community. The important point is we're addressing it and containing it and working with these companies to respond and address the issue.
Doc, were you involved in the formulation of this whole car score thing?
No, that's something the physicians group came up with along with Dr. Cabrera. It was originally designed to look at where our risk was in relation to other places geographically, and they decided it was a very useful tool. And I believe they're using that, the governor's using it to look at, wow, if we can get it down to 5, bring our risk down. It's just another indicator that they're using to see what's going on in terms of the patterns and the spread and all that.
So just as a territorial epidemiologist, do you think that it's a methodology that indicates our COVID health? With the different factors that go into determining it, are those factors that you would use as an epidemiologist to go out here and say, yeah, because of this, and this car score, that means that, we can have Thanksgiving?
I think it's a useful indicator. I'm not one who does a lot of modeling, and Felix Cabrera obviously does. Some people can critique those things. FEMA uses models as well. I think these are all useful indicators to tell us what's going on.
All right. Okay. So that being said, what is going on? I know it's been a tough week. Where are we with
Well, the CAR score jumped up because of these hundreds of cases in these congregate settings. That's what's going on. We're still seeing community spread as well.
Yeah.
We have seen a slight dip in cases and hospitalizations, but it's not gone down to the point where it's flat or, at a low risk. So we're still having widespread community transmission as well as the spread at these congregate settings.
So
we're trying to address it.
Right. And so you've done just a ton of the black construction testing that, we're doing this core tech testing where I think they're going to try and test 1,300. They have
1,300 employees.
Yeah. So then we did the DOC testing with public health doing all these testings, dealing with these clusters. Have we been able to simultaneously continue our community testing?
Yes. As a matter of fact, our testing capability is about to increase greatly. We've got, as a matter of fact, that's one of the reasons they're moving us out of the lab. We were supposed to do it last week. The lab is getting crowded. It's full of boxes. It's like an obstacle course. We just got 30,000 of the antigen tests, which are really good for use in those congregate settings. And it's a quick test, and it's for symptomatic people. So they're going to be, they're validating that. They were doing that yesterday, and they're going to try and roll that out as well. So yes, of course, we're continuing testing every single day, numerous runs every day.
What are you seeing with the community spread? Is it still household? How are people getting it? How are they spreading it?
Yes. And right now, this week, the hotspots were the congregate settings. But yes, we're still seeing household spread, workplace spread. It's the same old story. It hasn't changed, except for there's hundreds of cases in these congregate settings. We're not out of the woods. We're trying to put a lid on it.
How realistic is it to entertain the thought that somehow, with all this widespread community transmission, with these crazy clusters in the congregate settings, that somehow, with all of this going on, in about a month, we'll be able to have Christmas? Because that's the CAR score. It's kind of like this. What did they say?
She said it's like a reward.
It's a reward.
It's an incentive.
Yeah.
Well, I don't think people should plan for Thanksgiving and Christmas this year, unless you're just doing it with your household. We're not out of the woods. There's talk about a vaccine soon. Even that's going to take time to roll out. We're not out of the woods. It's been 8 months. These things take time. Maybe it'll ease up. But again, it's up to the community to continue to do what we're supposed to do. Wear a mask, social distance, wash your hands, sanitize, try to social distance. Boy, I had CDC people in my office all week. We were all wearing masks, but we really couldn't social distance because we had to address, we had the CDC deployment team out here. It's hard on people, I know, but we're not out of the woods yet. And there's hope in a few months that we will have a vaccine. And that's going to take time to roll out as well, because they're going to do healthcare workers first and so on.
Yeah, because I already told my kids that the governor canceled Christmas because of COVID. So I'm just going with that.
Yeah, but if we strive for 5,
we strive for 5. We're supposed to actually.
We could have Christmas in December.
A virtual Christmas.
I don't know.
It just, to me, I mean, I'm not a thinking man or anything, but it just mathematically seemed almost impossible that we would somehow not just get to 5, but get down to 2.5. And then, Christmas. Merry Christmas. There's a reward.
If you think about these kinds of gatherings, like large gatherings at Thanksgiving and Christmas, those are the exact same kinds of behaviors that facilitate the spread of the virus, just like congregate settings where you have a lot of people in close quarters, sharing meals and etc. So that's still a concern.
Yeah, I agree. I think that, like I said, I don't see us in a month. Somehow we're going to have Christmas, and then we're going to be right back where we started from. Third surge.
Right.
Yeah.
Right. Well,
Doc, can we, because we had I forget who was on yesterday, but they keep dropping the V word, vaccine. Saying that we're gonna have one by the end of the year. But when you read all the different national media reports, it doesn't really seem like that's a possibility. And how dangerous is it for people to be thinking that we're getting a vaccine on Christmas and that it's all going to go away?
Well, I don't know that it's dangerous. Obviously, the vaccine is the ideal situation, right? And widespread adoption of and people getting vaccinated. I don't know when it's going to happen, but the plans are in place nationally and locally and in the region. We do know that people are gearing up for when that happens. So obviously sooner is better than later, but
Right.
Again, it's going to take time to roll it out.
Yeah.
And there's logistics issues involved because it has to be kept really cold and you have to have 2 shots and all that. So it's going to happen. Mass vaccination will happen. It's just a question of when. I can't predict when, but people are obviously hopeful and making plans to have the vaccine and widespread adoption of it.
Yeah, I mean, I know you're not predicting it, but a lot of people are. And when I said dangerous, I meant that, people are looking at that vaccine as a finish line. And when we talk about all this COVID fatigue that supposedly is making people go all around the island because they're just tired of being...
Okay. I see what you're saying.
Yeah, so we're moving
gonna
the
have a
finish
vaccine
line.
in a month, so
Yeah.
I can do whatever I want.
Yeah.
Right?
Yeah.
No. Well, people still can't just do whatever they want, and they can't do whatever they want for other things like flu, and they shouldn't. There's all kinds of infectious diseases that require people to change their behavior, not just COVID-19, but influenza, colds. Remember, it's not just COVID. It's like you shouldn't go to work when you're sick with a cold either. You shouldn't go to sick with the flu either. You should stay home when you're sick. And if you have a STD or, there's procedures to follow for infectious disease and communicable diseases. So people can't just do whatever they want because they want to. That's not how it's supposed to work. A lot of this is human behavior, sexually transmitted diseases, tuberculosis. So it's not just COVID-19, but infectious diseases as a general rule. We were talking about this before. Chronic diseases are about bad habits. Infectious diseases are about dirty habits, which is why we're telling people to cover your face so you're not coughing and sneezing droplets and spray all over everybody or etc.
Doc, so I just saw that Department of Public Health and Social Services, in consultation with an organization that was going to hold a drive-through movie theater screening. So I guess they had met with Public Health, and the decision was made to postpone that event. But I had heard something about a concert this weekend, and I'm just thinking in my mind, like, if we're canceling a drive-through movie theater, why wouldn't we also cancel a whatever concert? Or are we? Do you know?
I do not know the specifics on either of those possible events or what policies they're following for the restrictions. Concerts and drive-through movie sounds, you're in a car, you're with your family, you can wear a mask. Concerts are a little more crowded. I really don't know. Where's this concert? That's not my call.
Yeah.
You're gonna have to ask somebody else.
I think when we had I think it was Dr. I forget which doctor, they said the risk was that people from different households would be riding together to go to these different events. And anyway,
well, that's probably true.
yeah.
And that's probably true regardless of whether there's a drive-in movie.
Yeah. Doc, so I know it's been a crazy week. What's next week looking like?
I don't know because we have a lot to do, rolling out the antigen tests. And we are moving next week. We're moving to the ITC building because the lab is too crowded and there's not enough space. That's been our problem. It's been about a year since the fire last year, right after dengue, and people have been put in different places. So they're moving us to ITC, so the lab will have bigger space and more storage for all these test kits that they've got coming in. And that's the plan. We're moving to getting a weekly surveillance report with some more detail. I'm presenting on the diabetes group tomorrow. More than half of our deaths have a diagnosis of diabetes, so that's a big concern. So we're talking about, this at-risk population. I believe they would also be targeted at-risk vulnerable populations with chronic conditions, and the elderly might be targeted for early vaccine after healthcare workers. So we're just going back to planning and we're getting a little bit more help. And so we're trying to roll out this weekly report sometime in the next couple of weeks. We've been talking about it for more than a month, but we haven't had time because other things keep cropping up.
Right. Doc, you said we're about to greatly increase our testing capacity. So I think we ran, where are we at, Jade?
Because we have the antigen test now.
Right. So
they're
by how
validating it.
Right.
30,000 antigen tests. Right?
Yes.
So
And it's a quicker test than the PCR, and they're trying to figure out the protocol on how to roll that out to the clinics. And it's for symptomatic people, but you can get results fairly quickly.
Is that a nasal swab, or is that like a prick?
I'm sorry?
Is that a nasal swab, or is that like a prick?
Yes, and it's not as invasive as the other one. They don't have to stick it all the way in. It's I don't know if they can also do the mouth, but it's quicker and easier, and it's not as reliable as the PCR, but it does give positive results fairly quickly.
So
And
since you said
that's why they recommend it for use in things like congregate settings and of course clinics. So we're working on that, rolling that out.
So by how much do you think we would increase our testing capacity? Let's say if we ran, for example, 900 tests yesterday, according to the JIC.
I don't know.
Okay.
I don't know. You should talk to Anne Marie at the lab.
Okay, yeah.
You should get her on.
What's her number?
I'll give it to you.
Well,
She's
Doc,
busy too. I mean, they're always busy here.
I know.
They need more space and more bodies.
well, we like it when you're busy. Doc, so I guess closing a message.
Just keep doing what you're doing. Keep social distancing, keep wearing the masks, keep sanitizing, keep your, family safe. And it's not over yet. We're trying to contain it and put a lid on it. The public needs to help. It's the same old message.
Thanks,
thanks,
Doc.
Ann.
Be safe.
Adios.
Okay. Hey, there's virtual empanada there in the Zoom room if you want to grab some for the staff. It's just hot, air fried. Okay, right on. We have options. We got air fried and then we got fried. So whichever one you want, Doc. Hey, it's 7:45. Quick break, and we're coming back with our favorite COVID cruncher, Dr. Peter Lombard. All right.
And you know what?
Yeah. What's up, Jay?
And he's got slides.
He's got